Hello, everybody, and thank you so much for joining the SIEC for today's Spotlight on Mental Health and Addictions Counseling event. We're so glad that you could join us today. We are coming to you from Saskatoon, which is Treaty 6 territory, homeland of the Métis, and we're really excited to be spreading across the province. We know that there are students and classes from across the province who are joining us today, so we're very, very excited that we could see all of you today and interact with you and share this information for you, which is very timely since it is Bell Let's Talk Day as well. So such an important topic every day of the year, but made that much more important today. So we're so glad that you could join us from whichever treaty territory you may be on today. My name is Aaron Adair. I'm one of the program coordinators for the Saskatoon Industry-Education Council. And just like to give you a little bit of information about us for those of you who may not be familiar with us. So the Saskatoon Industry-Education Council provides career development and discovery opportunities for youth, educators, and career practitioners through customized programming. At the bottom of your screen, you could see some of our programs that we offer every year that some of you may be familiar with. This is one of our online Spotlight on Careers programs. Normally, we would host 40 programs that are live in-person events. Of course, this year is different and we're online. Our skills boot camps, our Game On boot camp applications just came out, so you could check that out. Summer Youth Internship is always popular, and those applications will be coming out soon. And some of you may have been involved in our connected or digitized events or checked out our Relevance magazine in the past. So there seems to be something for everybody, and we hope that you'll always check out our website to see what might interest you as a high school student thinking about your career path. As a registered nonprofit, the SIEC works in partnership with 3 school divisions, so Saskatoon Public Schools, Greater Saskatoon Catholic Schools, and the Saskatoon Tribal Council and Prairie Spirit School Division. We work with community-based organizations, government agencies, and employers to help nurture the workforce of tomorrow. So even though we work very closely with these school divisions, you know, we're kind of lucky to be online in a sense because we are reaching across the province now, which is something that we're really excited about and grateful for at the same time. Of course, we would love to be in person with you today, but meeting online is a good option too. You can see that my friend Darren Bulmer just appeared on your screen. Darren is a child and youth mental health and addictions worker with the Saskatchewan Health Authority. He's going to tell you more about that role in a little bit here. I'd just like to give our participants a little bit of an overview of the event. So Darren's going to tell you a little bit about his career and about careers in this field. We are hoping that our students are going to learn a little bit about that. At the end of the event, I'm going to point you to a couple of resources that we have on our website, including some post-secondary resources that you may want to check out if this is indeed a career that appeals to you. We always say at the SIEC that finding out that you don't want to do something is just as important as finding out that you do want to do something, right? So maybe you're crossing a career off your list or something that you want to look into a little more. So stick around and I'll show you some more of that. Throughout this presentation, I know that Darren is really hoping that he's going to get a lot of questions from you today, so please don't be shy. Just use the Q&A function that you'll see at the bottom of your screen, and you can type questions or comments into there anytime, and Darren and us, we will be addressing those questions throughout. We really want this to be an interactive presentation, and so lots of questions for Darren today. He's up for the challenge for sure. And at the end, we were going to be asking you for some feedback for this event. We rely on that greatly as a nonprofit organization to report our numbers, but also to improve our events for the future. So we thank you for sticking around to give us some feedback at the end as well. So Darren, I am going to turn this over to you right away here. We're really excited to learn from you today. It's such a great day to be working with you, and I know that these students and teachers are excited to be working with you as well. So again, folks, shoot your questions to Darren at any time today in that Q&A function, and Darren, we're looking forward to it.
Awesome, thanks, Aaron. So, like Aaron said, my name is Darren Bulmer. I work at Child and Youth Mental Health and Addictions here in Saskatoon. I've been there for quite a while, 19 years, I think, coming up on 20. I've worked really only a few capacities. I started actually my career at Calder Center, which for anybody that doesn't know, that's one of our the inpatient drug and alcohol treatment center in Saskatoon. It treats children, 12 to 18, as well as they have an adult youth or an adult wing, plus their detox center. So when I first started there, they just had the adult and the youth program. We didn't have a detox place, but it's evolved and it's changed quite a bit over the years. So that's where I started in a long time ago, 2002, I think, actually, something like that. And then a couple years after I worked at Calder, I got a job in the community at Child and Youth Mental Health and Addictions, which is, for anybody that doesn't know where Child and Youth Mental Health and Addictions is, it's right. I always say, do you know where City Hospital is? Most people say, yeah. And then I say, do you know where the river is? And most people say, yeah. And then I say, there's a big red brick building right between that, and that's Child and Youth. So for those of you who don't know where community, Child and Youth Mental Health and Addictions, as well as community adult, and then the children's team. So all three different ages are in that building. And then obviously we have satellite locations that we'll talk about in a little bit. So I came down to Child and Youth a couple years after I started Calder. I think in 2004, I came down there and I worked as an outreach worker. And that took my career, did that for quite a while until I think maybe 2 years ago now, I took this job, which is called the Prevention Educator. And so it's cool. What I get to do is this. I just get to do presentations for communities, for schools. I'm doing one for the Open Door Society in a couple weeks. Excuse me. Various organizations. Anything about mental health or addictions that they want to know or they want a presentation about, they call me, and I get the joy of coming and people listening to me talk. So here's the difficulty about these presentations. So I've been doing them all year, well, ever since the pandemic happened. We've just been doing virtual presentations. For those of you sitting on the other side of the screen, listening to me talk, who are like rolling your eyes, maybe everybody is like wildly interested in what I'm going to talk about. I don't know. But I can tell you from the presenter perspective, like I really enjoy being interactive with people. So I appreciate Aaron telling you that at the beginning. I really want you guys to ask lots and lots and lots of questions, okay? And the old saying, there's no stupid questions. It's really true. And especially when it comes to mental health and addictions, because mental health and addictions is such, there's still so much taboo around it. People are scared to ask questions, or, the whole stigma about mental health, it's still there. It's huge. It's so huge. Personally, this is how big it is. And I'll tell you, I was diagnosed, about 2 and a bit years ago with depression. So I'm 45 years old. And yes, I know I don't look 45. Everybody says that, don't worry. Especially, just so you know, I've been growing my hair out for COVID. Just, I don't know, why not? And my beard. And so, you know what I think I'm going to do? Because it's so red, I'm going to let it grow big and bushy. And then all I'm going to wear around everywhere, winter, summer, doesn't matter, is a fur vest with my big red beard. Viking look. Anyone? See, again, here's the online stuff. I don't know if people are laughing.
Hey, Darren, I'm laughing, man. And I don't know, I think that Viking series stopped filming now. So I think you could have got another role with maybe being an actor on that TV show. But yeah,
totally.
but maybe they'll do a spin-off like Game of Thrones or something, right?
Totally.
Yeah, there you go.
And I'll be the lead in it.
Yeah. Oh, and we got a comment. Yeah, totally. That would totally work for you. So there you go.
Perfect. Thank you, Lexi.
That's awesome.
So yeah, especially. So I was diagnosed 2.5 years ago with depression. And it's crazy because it's only been recently that I will actually tell that story. Now I have no idea. Aaron, do you know how many people are on the call right now?
We have got about 15 or so, and that includes a couple of classes who are involved.
Oh, okay. So, yeah. Okay. Yeah. Well, anyway, I do these presentations all the time. I have no idea why I don't ever talk about my own story. It's not like for me, it's not a therapeutic thing that I have to share and talk about myself. It's more of an understanding for people because I mean, I don't want to, it's not an arrogance or anything like that, but when people meet me, it really kind of hits home, especially if I'm doing a presentation. So I'm doing a presentation in front of like 300 students, which is not uncommon for me to do. And I'm pretty dynamic and I like to be very interactive. I have lots of energy, right? When I get to the point that I tell people that I have depression, it floors lots of people. There's a lot of people who are like, you know, surprised, because what do you think depression is? Well, it's not a guy standing up in front of you telling you about mental health, making jokes in front of 300 people. That's not the impression that people have of depression. So I think, like, for me, it was a stigma thing. That's what I'm trying to say. We have such a stigma attached to mental illness, and we need to kind of get over that hump. So we need to start talking about it. So back to my point, I really want you guys to ask lots of questions, okay? There's no dumb questions. I appreciate any questions, especially the ones that really, really challenge my knowledge. It keeps me fresh and keeps me kind of on my toes. So it's a learning experience for all of us. So please be interactive. Use me as your encyclopedia. I'm probably one of the smartest people you know. And so, you know, you probably want to take advantage of asking me questions.
Oh, here you got one. You got one right here, Darren.
Yeah, what does it say?
So it says, what organizations working on mental health are there, I believe, in Saskatchewan? I am a newcomer and working on a project including a theme on mental health, especially Sask organizations. So other than the Health Authority, are you aware of any other groups perhaps?
Yeah, so like I said, at the end of the month, I'm doing a presentation for the Opening Door Society. So that is one of our connects, like within the city. I'm not sure where Mohab is, but
yeah,
in the city, we usually would, Opening Door Society is where we would usually direct people to go.
Yeah. So the Saskatoon Open Door Society for sure. Yeah.
And I'm doing a presentation for them. And so I know they really want to start, and I did lots last year about addictions as well. So they really want to start adding that aspect to newcomer families where they can have that connection.
Good tip. Right on.
And schools as well. Again, I'm not sure where you're located, Mohab, but I know in Saskatoon, in all the public and Catholic schools in the city, they have an EAL worker. And the EAL connections usually have with, the support settlement workers. They're called Swiss workers. Sorry, Swiss
workers. Sure. Yeah.
So all of the EAL teachers, so that's right from kindergarten until grade 12, have connections with the Swiss program, who also have connections to newcomer programs in Saskatoon. So,
and Darren, I would also suggest the school counselors may also have leads on some programs that Mohab may find interesting as well. So yeah,
for sure,
you bet. Yeah, great. Yeah.
Okay, so stigma. Ask questions, please. In terms of my career, I said I worked at Child and Youth. I told you what I did, so I'm going to explain a little bit about Child and Youth. And so our red brick building between City Hospital and the river is where we're located. And within my team, so I work with children and youth. So that's our mandate is 12 to 18. The children's team works with the 0 to 12, and then the adult team works 18 plus. And so on my team alone, we have our main site, which is Queen Street. We have YRC. We have, what else do we have for satellite program? Well, those are the two big ones. Oh, Calder Center is a satellite of ours as well. I can't think of anything else right now. But at Child and Youth, so where I work at Child and Youth, on our outreach team, so we have, I think, 6 outreach workers, which is what I did for many, many years. And that's a pretty cool gig, actually. Like, our outreach team has a really awesome opportunity to work with youth because they do it in a completely different way than kind of traditional therapy. And so, we go to the school all the time. Well, COVID has kind of messed this up a little bit, but we'll go to the school. If there's a kid that's really not connecting with people, maybe they've tried some counseling and it didn't work because whatever, we'll go in and we'll try to make a connection with the kid in a different way because we don't have to meet with them in an office. It's just a completely different setting. So we'll take them in our car and go for a coffee. We'll just a ton of different ways to connect with kids. And it's a super cool opportunity because you just have lots of freedom in terms of how you get to connect with kids and how you want to connect. Like, over the years, the countless different things that I've done, like biking down by the river with kids or going to the batting cage, or I don't know, art stuff, like just going to Sky App and doing art project, like just crazy ways that like a person who's sitting in an office doesn't have the same opportunity like we do. So I work on the outreach team. There's 6 of us, I think, on that team. There's our addictions counseling team. So we have 2 addictions counselors. We have our social work, our therapy team, which is, there's BSW, so Bachelors of Social Work, and MSWs, Masters of Social Work. We have 3 psychologists, so PhD psychologists who work with us. We have a dietitian who works with us. We have 2 rec therapists that work with us. We have a psych nurse, a community psych nurse who works with us. We now have a psychiatrist who works with us. So that's just on my team alone. And so then I said YRC. At YRC, they have what's called the Young Offender Program. So they have a bunch of psychologists over there who deal just with court stuff. So court orders, assessments, that kind of stuff. And I don't know if you guys know what's over there. It's the Red Cross used to be right there. There's an orange brick building on 20th Street, right at the end of 20th Street. And that's where YRC is. So on the top floor is where all the psychologists are. And then on the bottom floor is what's called the YRC Day Program. And the Day Program is a school, it's a mental health school, I guess. Like a kid that's struggling in school couldn't get into YRC. There has to be significant mental health concerns in order for these kids to get in. And the numbers are really, really small, 15 kids maybe. And then they have a teacher, an EA, a social worker, 2 rec therapists, a nurse, and that might be it. So that's 6 people there might be 7 staff actually, for like 15 students. So it's a very intense program. You still get an academic focus, but the wellness is really what they focus on mostly there.
Hey, Darren, I've just interrupt you for a second here. And just for all the students listening, I just think of just from the last few minutes here, you think of all of the different roles that are involved in this field. So not just a role like Darren has, but thinking about nurses and rec therapists and all of the other roles that he mentioned there. There's so many different paths. I was in a workshop yesterday actually thinking about challenges that you want to address in your career. And then figuring out your actual career role after that. So thinking about what kind of challenges you want to do to fit in. And I think that's a good way of looking at things. And this actually relates to a question that has come up, Darren, which is what post-secondary training do you need to be an outreach worker with the SHA?
Okay. Oh, sorry. You know what? Sorry, my fault. I'm like, there's the Q&A. And then there's the chat window.
Yeah, we're gonna try to direct those questions into the Q&A. So you bet.
Okay.
Yeah,
I'll leave it up here now. Okay.
Mm-hmm.
So which one was the first one? Can I answer? I'll just go in order.
There was one that I just asked, which was what post-secondary training do you need to be an outreach worker with the SHA?
So the minimum that you need is a 2-year diploma from SIEC, or no, it's not SIEC. It's called Sask Polytech.
You bet.
The Sask Polytech. And it's called Chemical Dependency Worker Program. So that's a 2-year diploma program. It's through PA, or at least it was when I took it. But we also have 4-year social work, Bachelors of Social Work on our outreach team. But the minimum requirement you need to get into that role would be a 2-year diploma from SIEC. Yeah.
Perfect. And as I mentioned at the start, students, we're going to show you a link where we have combined a bunch of post-secondary resources for you, from the Sask Polytech programs to the U of R social work program as well. So some good options there. Another question came up for you, Darren, relating to careers. We have a question from a teacher that says, my students want to hear about careers that are up and coming in a psychology field. So you mentioned that psychologists are involved with the work that you do as well. Is that true?
Yeah. Yeah. So we have 3 psychologists that work specifically on our team. And so they do therapy with us. Okay. So, it's kind of the complexity of the cases that are coming in that determines where they go in terms of what worker they go to based on your skill set and whatnot. So our psychologists on our team do more of the kind of more complex, well, I don't even know if that's the word, more that need a psychological lens as opposed to just a counseling lens, right? So
Okay.
if it's something psychosocial or it's a relationship thing, it's our social workers that do that. But if it gets in more into like the psychological stuff, then that's where we will access our psychology team. They do assessments too, for us, or for their clients as well. And then in terms of the court place, which is, I said YRC, which are with our young offender team, they're like, I think they're all, well, most of them I think are PhDs. So,
Oh, wow.
yeah, there's like, they must have 4 for sure over there out of maybe a team of 6. 4 of them I think are PhDs. There's a couple masters of psychology, but yeah. So
great. So just looking into those programs at different post-secondary institutions and getting some advice from counselors there as well, career counselors, could be something that students could look into for that for sure. So we really appreciate that question. Yeah. Excellent. We're getting a couple questions about mental health in particular, not away from the career side, if you want to address those right now, Darren.
Yeah, let's do it.
Yeah, okay. So we have 2 questions. The first one is, what do doctors use to diagnose depression, or how do they come to that diagnosis?
There's a whole bunch of different tools that doctors can use, I guess, to assess kind of where they think things are at. So it's a combination of, like, there's like a PHQ-9 would be one that a lot of psychiatrists would use. It's a really simple tool. It's a few questions just basing kind of like a 1 to 5 scale. And then they, the total, if it's over X number of points, it's something to look into. If it's under, probably not. So there's lots of different tools they use like that. It's just kind of a preference, I think. But how you actually get a clinical diagnosis is from the DSM-5. And so the Diagnostic Statistical Manual, and it's the 5th edition. And that's just, that's the book of mental illness. And so have a look at it. It's actually fascinating because, the language, mental health and mental illness, like whatever term you want to use, we throw them around, those terms around too loosely. When we talk about, like, I say to kids all the time, how many times has somebody asked you how you're feeling and you say, I'm depressed. I'm just depressed today. I'm not feeling good. I don't know. Well, you're not depressed. I have depression, and I can tell you what you're feeling today about being sad about something is way different than me being depressed. Okay. It's way different. What you're experiencing is being sad. And so if you look in the DSM though, the different criteria that you have to meet in order to have a mental illness, it's not just being sad for a few days or, for a few weeks. It's like, there has to be a whole bunch of set of behaviors that are present for like weeks and months at a time that are really impairing your ability to function, all that stuff. So, yeah, it's not just about being sad.
Yeah, and Darren, related to that, we've got a lot of questions coming in now, so this is great. A person, or I believe a teacher asked again, are there physical symptoms that may pop up before people are aware of a change in their mental health that may lead them to seeking some help? Any insight into that?
Absolutely. When I do presentations, I tell people, when I'm working with a youth, 2 of the questions that I ask if we're trying to query kind of just a general, we're trying to figure out what's going on, right? How are they sleeping and how are they eating? And those are 2, if there's huge changes with either one of those things, it's often a sign that something's not right. A physical symptom, like a lot of times for guys, here's how I was at it. This is how I realized I was like, I've been depressed for all these years. I work in mental health. I never had this insight. I went to a counseling session because I do that because it's healthy. That's another thing everybody should do. You should get yourself a therapist and you should go see them on a regular basis. Get all that stuff out. It's just really, really healthy. Anyway, we're sitting there talking about how mad I was getting about things and like mundane, stupid things, really. And my counselor said to me, she was like, well, lots of times with males, depression comes out in anger. And I was sitting there and I was like, are you kidding me? That's exactly what it was. It's exactly what it was. So I don't know why I just told you that. I also have ADD, just so you know. Sometimes I jump around and bounce around from question to question.
Let's just see. I'm just looking at the other questions that we have here. Oh, well, just back to the career piece. Emily asked a question here. What are some of the major differences between becoming a psychologist, psychiatrist, or even like psychiatric nurse? Um, is there a different focus on those types of career paths, or is that, like I mentioned, maybe a specific kind of challenge that you want to work with every day, perhaps, depending on the field you choose?
Yeah, for sure. Well, I mean, what lots of people don't know is the difference between a psychologist and a psychiatrist, even just that. A psychiatrist is a medical doctor, okay? And what their role is to understand what's going on in, well, in everything, but specifically your brain, and they prescribe medication to treat that stuff, okay? Whereas a psychologist doesn't prescribe medication, and most of the time, psychologists do more therapy. Like psychiatrists don't typically do therapy. That's not really their scope of practice. Although the psychiatrists we have in the city here in Saskatoon are phenomenal, and a lot of them have an aspect of it in their practice. But it's not really like a psychologist would do therapy assessments, like an MEd. If you're interested in education, you would go get your MEd, so your Master's of Education, and that would qualify you to be able to do educational assessments. But it would also qualify, I mean, depending on where you went in your Master's, and depending on what you focus on, you can focus on assessments, you can focus on therapy. Like there's different routes within the master's program when you go to get it, depending on what field you think you want to do. If you wanted to do educational assessments, obviously it would look different for you.
Right, and psychiatrists would follow a med school path too, right?
Yes. Yeah.
Yes, yeah. And for that question that Emily asked there too, folks, if I'll show you our website at the end. I've been mentioning this a couple times, but we had an event back in December where we looked at healthcare, and we had some representatives from the University of Saskatchewan College of Medicine, and even a psychiatrist who was connected to that program. And we also had a nursing panel as well. So I know that the role of a psychiatric nurse came up too. So if that's something you're thinking about, you might want to check out both of those events on our website, and I'll point you to those a little bit later on, for sure. Next question. I'm not exactly sure perhaps what the person is getting at, but Darren, this person was wondering about identifying people who are perhaps, you mentioned ADHD before, who may exhibit symptoms of ADHD or perhaps even autism. And the person asked how to deal with a person who may exhibit those symptoms without being ableist. Do you understand what the question's getting at there?
Yeah, I mean, that's the difficulty, I think. Like, how do you deal with somebody with ADHD? Well, it depends on the person, because not everybody that has autism behaves the same way and has the same symptoms and the same behaviors as a person with ADHD. I guess like common things you would see with somebody who has ADHD, impulsivity, just relationship difficulties. ADHD people typically are like really intense with relationships, and then they kind of pull away. Like that's kind of a behavior. Stirring the pot, like, if you have one of your friends who's always kind of like throwing in little digs at people, and then all of a sudden the next thing you know, you guys are all arguing about things, like that's a common behavior of an ADHD person. So how do you deal with it? Again, that's, it's a big question, I guess. It's kind of hard to answer how you would deal with an ADHD person. I just hope whoever asked the question can appreciate that. If you had a specific like person or like a situation you actually want me to, I could talk about that. But
I think too, Darren, I think you'd agree, like, we're not necessarily asking a person to diagnose one of their friends as being ADHD or something like that, right? Just being overall, whether it's depression or anything, perhaps just treating the person with sensitivity and respect and so on. Maybe
absolutely, yeah.
Maybe to expand on that a little.
Yeah, for sure. And I think, one of the things, I guess, following up on that, and I don't know if this is along the same line, but a lot of times kids ask me, like, what if I have a friend? Like, that's a lot of times what people are, and maybe that's what you're asking. You have a friend that you're concerned about. I don't know, but I'll answer it anyway. Mm-hmm. And I always say, because everybody on the call is high school age, right?
Yes.
Yeah. Yes. Okay. go to the school counselor. Like if you have concern about somebody, like the school counselors, all like rural or in the city, they're all connected with their mental health supports in the community, right? So like for me, for instance, like, I don't know, even just yesterday, I had 2 school counselors just call me, not just to say like, hey, this is this kid and I want to run this by you. And so like they know what to do, and they know. So if you had a friend who you were worried about, or if you're worried about yourself or your mom or your dad, or I don't know, the school counselor is a great place to start all the time.
Mm-hmm. Yeah, and Darren, this person actually just responded and said a close person to me was identified as having ADHD, so I want to know how to deal with him without hurting him. So that's where the question's coming from.
Yeah. So here's what I'll tell you. Do you know what the best thing for you to do for that person is? To find a resource where you can read a book and you can understand what ADHD is and how it actually affects a person. Knowledge is power, you guys. And so like, especially with mental illness, like just knowing about it, like you're going to have people in your life, if you don't already, who suffer from mental illness. You might marry one, and it's hard, and it can be really hard if you don't know what it's all about. And so ADHD, no, I think it's called ADHD and Me, I think is the book, is a really good one. But there's a ton of resources. There's tons of resources.
Yeah, you bet. And I think, just with all of the resources we have at our fingertips now too, right? Reading reviews to find there are many resources on the subject, but maybe taking some time to find one that you might connect to would be a good suggestion for that person as well. A couple more great questions coming in here for you, Darren. Do you think an individual diagnosed with mental illness makes you a better outreach worker?
Well, here's the other side of that too, because I'm an addictions counselor as well. Like that's my background, right? And so I get kids ask me all the time, like, did you ever do drugs? And it's the same kind of thing. So does it make me a better, I don't know, like, yeah, I guess. But I also say this, my family doctor growing up was Dr. Harrington, male doctor. And there's 4 of us. So I have 3 sisters, and he birthed all 4 of us, and we're all super healthy, no complications with the birth. He was a great family physician, amazing family physician. He has never given birth, but he is phenomenal at what he does. Right. So don't get too caught up. I guess the tale of that is, don't get too caught up in, if this person has a mental illness or not, and can you connect with them? Because I think that the thing about therapy that you need to do the most is you need to find somebody you connect with. It's like a pair of shoes. If you go to a therapist and you walk out of it, you're like, that didn't feel good, I didn't like that person, try the next person. Because you don't go to the store and buy a pair of shoes and it fits and you walk around and everything's perfect. Usually you got to try a few pairs on to see what feels comfortable. And it's like shopping for shoes with therapists. So
and Darren, getting to that point of actually seeking advice or support from a therapist can be difficult for a lot of people, right? Is there any advice that you give to people just to make that step of seeking help, whether it's from a family physician or perhaps seeking a counselor or therapist?
Yeah, it's a slow process for sure. And it takes people a lot to get there. When they're actually, like in my experience, when people are actually at the point where they're starting to ask for help, they're pretty willing. You know what I mean? Like it's taken a long time for them to kind of get up to that point. Having conversations with people, just understanding, I don't know, knowledge is power. I just keep thinking, the more you can understand, especially with mental illness, like mental distress versus a mental illness, just something as simple as those 2 terms. Everybody has mental distress, right? It's regular stress. That's what we're going to call it. To whatever varying degrees people experience that, whether I have a mental illness or I don't, I'm still going to have distress. And so I still need to learn the skills necessary to be able to deal with stress and deal with life circumstances. Sometimes it just makes it more complicated if you have a mental illness, but at the end of the day, everybody needs skills. It doesn't matter who we are. So yeah, everybody needs skills. Mental illness, mental health, we all need skills.
And I think of that person who was asking about her friend before, or his friend. I think that just being there to listen and even offer, offer some support, maybe suggest seeking some professional help would be a good thing that a friend could do. Just one thing that I'm assuming just based on the conversation so far.
Absolutely. Yeah.
Yeah.
As a teenage friend, what your job is to support your friends for sure and to listen to them when they need the ear, but it's not your job to help them in terms, like, you need professional help to do that. And so
Mhm.
there's various ways, but always go to your school counselor. Like, that's just, it's an easy in. They have access to all the resources. They have access to us at mental health. Yeah, I would.
And I think seeking, even as a person seeking support for someone else, just seeking some advice from a counselor, like you mentioned, of how to help your friend and maybe not make too many assumptions, perhaps. I think
For
that
sure.
would be a good thing that you mentioned. And a person just asked, so the skills that you were just talking about, the person said, how do I learn those skills? Is it only from therapy or the resources you talked about before? Or are there other ways?
Reading, I mean, that's where you don't necessarily need to go to therapy, no. But I mean, I think, again, I think everybody should go to therapy. You should have somebody, a neutral person that you can talk to about what's going on in your brain or in your life or whatever, and like, not a friend or something like that. So no, I mean, there's zillions and zillions of self-help books that you can read. Like, for instance, this one, hang on.
I'll entertain while you're over there.
Sorry.
That's okay.
It's right beside me, and I actually just lent it out. It's called The Upside of Stress. Super, I would highly recommend everybody to read that book. It'll change your life about how you view stress, really. In the book, I'm going to tell you, in the book, it talks so much about how you deal with stress, and the strategies you have around that aren't nearly as important as how you actually view the stress. Like, do you think stress is bad? Have you been given the message in your life that stress is bad? If you have, it's important that you try to restructure your thoughts around stress. Stress shouldn't be something like, as a parent now, I have, like, sure, is it stressful? I don't know. It's busy. That's what I would say. It's busy, but everybody's life is busy. So how do we start understanding that better without it kind of consuming us and taking us over? And that Upside of Stress will teach you that. It's a super good book. Very, very, very.
And you mentioned stress before. You mentioned the difference between sadness and depression. There's a difference between stress and anxiety in a sense too, right?
For sure. Yeah,
Yeah.
absolutely.
Yeah.
Yeah.
And we just had a great comment that came in from a student who said, not a question, but as someone who has ADHD, just being a supportive and patient friend is important because it can be frustrating even for the person who has ADHD in this case, right? So just being supportive and patient is her advice. And I think that's great advice.
For sure. As an ADHD kid, I can't tell you how many times I can like, how many times I would have an emotional outburst, especially with my parents, is probably who I remember it the most. But I would, because I was just an intent. That's what ADHD is. I was impulsive. I didn't have that ability to kind of slow myself down and process things first. I just react really fast. And I don't know how many times I would react to something, and then after the incident was done, how awful I would feel about myself. So yes, that comment about, like, just understanding and being patient is such a good point.
Yeah, for sure. Hey, Darren, we got about, I think, 10 minutes or so left. So we just encourage everyone else to get some more questions coming in. One of the people read my mind, because one of the things you and I wanted to cover today was just thinking about, we're in a pandemic. Some people may be watching this recording, but mental health has gained a new focus for people during a pandemic, and the themes of isolation and so on that people are feeling. I'll ask two questions that are here, but start with the first one here. During this pandemic, have you found that teenagers are using your services more or being referred more?
I should have got those numbers for you, because that's a really good question, because it's interesting that I don't know if it's increased at all. And here's why I would tell you that is because a lot of kids, like, let's say we work with a lot of kids who struggle being in a social setting in school, whatever that's about. Maybe it's a social anxiety, academics, whatever. Now with kids being at home more, I think a lot of those kids are doing maybe better, because they're not being, the pressure of the school isn't so. But then on the other side of that, all of the stress from the pandemic, like our intensity of things. We were just talking about it this morning on our team call. I feel like we've had an increase in intensity for sure.
Oh.
Yeah. So we do a thing called violent threat risk assessment. I don't know if everyone's ever heard of it. It's VITRA is the short term. And I've done 5 of them in like the last 10 days, which is crazy. Like, yeah.
Wow.
So the severity, I feel, is maybe has increased. I would think that our referrals aren't up or down. I bet you they're probably just exactly the same. But for the reason that I think people who were struggling a lot that were in school maybe are actually settled down and doing better. But then there's a whole host of other people who are taking their place of coming in for referrals.
And do you know if there's evidence of, that lack of face or in-person interaction that some people have had and that isolation that people talk about? Is there evidence that takes a toll on people?
Yeah. We just did a big study on that. I haven't got the results back, but just how it's affecting our ability to connect with people because we're doing it all electronically. Personally, I hate it. I don't like it. It just doesn't. Well, like right now, I don't know. Like, let's say we have 100 people on this call. We're just 2 talking heads. I don't have an opportunity to connect with people, and that, like, as a human being, it's part of our like DNA to connect with people. Even for people who are like real introverts and like just want to stay in their basement, there's still some element of connection that everybody needs to have, and it's tough slugging, you guys. I don't know how else to tell it. I think, we need to try and find positives in everything that's going on right now. One of the things I've said to parents a lot is that, be thankful that the weather has been so nice. I mean, with the exception of the last few days, but up until now, I know for myself, I've been outside way more with my kids. You just have to try and find positives in what's going on. Stay active. Make sure you're eating nutritious food, drinking lots of water, staying hydrated, trying to get good sleeps. Like all of those like real self-care things that we should be doing anyway become even more magnified and more important right now.
Fantastic advice. Yeah, awesome. Other question, and thank you to this person for being patient because it's been up for a little while here, but it fits in well. If you have someone in your life who you believe is showing signs of depression or what you think is depression, what do you do?
Well, I would talk to them. I think be honest with people. I mean, that's the approach I take in my clinical job, right, at mental health. I think just being honest with people. So if you have a friend who you're concerned about what's going on with them, be honest with them. Describe behaviors. You're not interacting with me as much, and you're not, I don't know, whatever the concrete, you're sleeping more. You just seem down when I see you. Describe concrete behaviors and just be honest. I'm concerned about you. Is there anything that I can help you with? Is what's going on? Just have an honest conversation with your friend.
Yeah.
Be supportive.
Perfect. That's great. Yeah. So any other thoughts, Darren, just about, with the pandemic and what we're seeing now, any other advice you can give to the people who may be watching live or watching our recording afterwards?
Stay hydrated, eat good food, get exercise. It's more important now. I think I have to stress that to everybody. There's not a magic pill to fix things. We need to do what we can with what we have. Get lots of sleep, try to reach out as much as you can. Remember everybody's in this together. Nobody's different. We're all having the exact same restrictions and all of those things that are being put on us. So, continue to stay social as much as you can. Try to stay off devices, interact with your parents. I don't know.
Oh, a really interesting question just came up for you here. Just a little bit different than what we were just talking about, but really interesting. This person says, concerning the climate crisis, it's complicated here, but I want some views on how to avoid burnout as an activist. Interesting, hey?
Yeah.
Maybe you were just talking about being on devices, right? I mean, sometimes we are overburdened by some of the messages that we're taking in, perhaps, right?
Well, and the thing with social media and just, device in general is you can be inundated with whatever information you need to, so I think, again, that's a checkpoint that you have to have some sort of self-check on yourself to be able to stop that, because, you know, the more digging, the more rabbit holes you go down, the more information you can find about anything, really. So understanding those limits and trying to put them, maybe it's a time limit you need to put on how much you can search. But you need to have some sort of break from that, where, you know, as an activist, yes, it just can't be everything that you do. You need to have something. You can't be a one-trick pony in anything you do.
And I think whether, like this person mentioned, being an activist, or whether you're helping somebody through a tough time, just that self-check-in that you were just talking about, to take care of yourself too, right? Absolutely. And to step back and seek some help too. That's a good thing. Another great question for you. I love how these questions have been rolling in today, Darren. This is good. Do you find that your profession takes a toll on your own mental health or well-being? And how do you handle the pressures of your job?
Yes and no. I think earlier in yeah, it does. The nature of the business that I work in is just the recidivism. Like, people, it's a tough slug, right? You know, helping people get over those humps. So part of avoiding burnout is understanding, maybe just redefining what success looks like with your client base. Because when I first started, I thought everyone was going to be fixed. You know what I mean? Or things were just going to improve at a faster rate than they do. And so understanding what that looks like, you know, and there's limits that what you can do in terms of helping people. I tell people all the time, I have a work cell phone. This thing shuts off at 4:30. So I tell clients, and we work with pretty high-end clients, and even they're like highly suicidal kids, I say to them, if you're feeling suicidal at 4:40, I am not the person that you're going to call, because you won't get a hold of me, right? I try to be really rigid with even my lunch breaks now. You know, we get a half an hour, and I try from 12 to 12:30 or 12:30 to 1 to make sure I'm taking that break for myself. And so again, it's my own personal boundaries through years of working that I had to realize that, because I can't fix everything. So the biggest takeaway that I have for everybody is, I know at the end of the day now, when I turn my phone off, that I've done everything within my power that day to help whatever I could on that day. Obviously, there's things that aren't fixed that tomorrow I'm going to have to deal with. But in that day, did I put in the effort for my clients? Did I get everything done that I could get done?
Excellent. Yeah. That work-life balance is important for you, for sure, right?
Work-life balance was like, it was the key to my success, hands down, for sure.
And I think anybody thinking of any different career path, maybe it's not even in this field we've been talking about today, but that's something that would be important for anyone, right?
Yeah, for sure. The helping profession seems to have, you know, that happens a lot with people. I think we just take too much on. People who get into the helping profession are helpers by nature, right? That, like, we just want to help people all the time. And you get into a role where, you know, there's other pressures, like other agencies you have to work with, that maybe things won't come together, and there's just so many other stresses you have to work with. It's not just about being able to help people. There's all that other stuff. And so it's really important to have a work-life balance, for sure.
Excellent. And just to follow up to the thoughts about your own career path, Darren, what are some of the positives, the things that you really love about your work, and what keeps you going?
Yeah, I really like this. This is cool, because like I said at the beginning, stigma is still a huge part of mental health. Bell Let's Talk is great, you know, for awareness, but we need to start doing more. Like, it's not just about helping people. It's not just about talking and saying, oh, depression is a thing. You know, like, we really need to start doing more. And we are. Schools are getting more involved in mental health. Like, we are, as a society, we're doing more, for sure. So this is great. The best part of being an outreach worker that I love the best, I just loved getting to know people, understanding people's lives. People are fascinating. And the more you can kind of learn and be curious about everybody in your life, the solider your relationships get with everybody. And so that natural curiosity that I have about understanding people just, you know, marries into what I was doing for so long as an outreach worker. And I loved it. I loved that part of my job.
Awesome. And was that the same as an addictions counselor? Same, just those connections you were making with people and getting to know people?
Totally. Yeah.
Yeah. Awesome. That's really good. Well, folks, if there are any last minute questions, I would encourage you to type them in. I don't think we have any right now. But Darren, just any final thoughts for people, whether it's about the career piece or just some advice right now?
Yeah, I mean, I wouldn't discourage anybody from getting into the career at all. If you're a helper by nature, getting into like social work, whatever, is a great career. Um, Making sure that you're keeping yourself healthy is really important in it, though, so you don't get burnt out. But in terms of a fulfilling career, I couldn't say that I would want to have done something different for sure. It's and even if I did, I'm too late into it anyway. I can't switch. But I
Yeah.
don't have complaints. It's been great up until this point.
Excellent. And I think of the things that I'm just taking away from this event, and I imagine it's the same for a lot of people, but just thinking about, the role that people play in helping other people and even seeking help, no matter what your role is, whether you're professional or just a young person trying to help out a friend, or whether you yourself are experiencing some challenges, just seeking some help is really important, which is one of the themes that you've come away with. And I also just think on the career path, just going back to the point we made that, we came up with a very general title about mental health and addictions counseling, but there are so many different roles within that for those of you who, like Darren just said, want to help people. Psychologists, psychiatric nurses. We've talked about so many different roles that people can have, and I think there's so much to research and so many possibilities and different paths that people could follow. Right?
Yeah, absolutely.
Yeah.
Absolutely.
Awesome. Awesome. So I am just going to share some information with the people who are watching here. I'm just going to pop this up for people to take a look at here. So I just wanted to mention, folks, that or go back to something I've mentioned already, but actually show you here. We have a few more resources. We've been putting on some events this week and gathering resources that could be a starting point for some of you who are interested in this as a career path. We have on the website address that you see there at our saskatooniec.ca website, you can see that we have some resources for you. We have a post-secondary video series, and this month we're focusing on those mental health careers. We're looking at a social work program from the U of R and some Sask Polytech programs as well. So you can have a check at that. If you're interested in helping people in wellness career, we just uploaded a great video with some local professionals, a physiotherapist, a chiropractor, and a massage therapist. So a little bit different than what we've been talking about today, but still helping people and making people feel good. So there's something. We did a Mind Your Money webinar, so a financial literacy presentation earlier this week. That is going to be posted soon. And last night we just hosted a occupational therapy and physiotherapy panel with a bunch of experts. It was a fantastic event, and that event is going to be posted on our website soon as well. So if that's something that you're interested in, I encourage you to check that out for sure. Darren, we did get one more question that just came in. So before I maybe get the feedback from everybody, I'll just direct this to you. But it says, is there a way to help but not have it be your full-time job? Sorry if it's late. So maybe I'm getting that this person may be feeling that there's it takes a toll, perhaps. Is that what the person's asking, do you think? I believe so. Is there a way to help but not have it be your full-time job, or perhaps as a career even?
That's an interesting question. I don't know.
Lexi, if you can expand on that a little bit, that would help. But
like you like helping people, you just don't want to do it all day long, kind of thing. Maybe.
I suppose so. Yeah.
I don't know how to answer that actually.
I suppose if it's not a full-time job, literally, I mean, there are volunteer experiences where people can reach out and help people, right? Which is also something fantastic for a person's resume. But there are those personal benefits that are very important as well.
I was going to say, the volunteering route for sure.
Oh, and Lexi's followed up and said, I love helping, but it can be quite tiring. So she loves helping people, but it can be tiring. So any thoughts on that, Darren?
it's very tiring. It's exhausting. And that's why you need help from people. So, I mean, I don't know, Lexi, if you're the person that lots of your friends will go to when they're having problems, maybe that's who, you know, how everyone relates to you, and that can be exhausting. So it's really important that you are making sure that you're directing people where they need to go, you know? So school counselors, you know, I don't know, school counselors are always just the easiest person because they know where to go, what to do, who to connect with. Like I always say, maybe a trusted adult, but sometimes adults don't even know, you know, where to call or who to call. So
just a really good starting point is talking to that counselor, right, who may be able to push you in the right direction, and just knowing to take some time and seek some help for yourself as well if you're feeling burdened. So yeah, for sure. That's a fantastic question. Folks, I am just going to put this up on the screen. So if you're a student who's watching today, whether it's live or you're watching our recording, I mentioned at the start that at the IEC, the SIEC, we really appreciate feedback for many reasons. And so if you were able to scan this QR code, or if you're able to go to the website that you see on your screen to give us feedback, we would very much appreciate it. It only takes about a minute to fill out, and there is a little incentive attached to it. If you are interested in doing it for that reason, that's fine. Teachers, if you have watched this event, we have a specific link for you. You can check out this QR code, or you could see the teacher feedback link there as well, and the prize option is there for you as well. So I just wanted to show that to you. Also, folks, I mentioned our SaskatoonIEC.ca website. We have many different themes coming up for the rest of the year, and we've covered a few already. You can see a few of the months that have already passed, and we also had October. We focus on science and technology careers. But if you have any interest or you're curious about any of these different fields, we hope that you'll participate in some of our events or check out the resources in the coming months, or even go to our website to check out stuff from past months. I mentioned our December healthcare month, which is closely connected with what we were talking about today. So you may find something on there that is interesting as you just think about your career journey. I definitely want to thank Darren again for joining us, and the Saskatchewan Health Authority for being a partner on this event. I want to thank our SIEC staff for helping out as well. And I also want to thank our teachers and contacts in our school divisions for spreading the word about our Saskatoon Industry-Education Council events. We couldn't reach out to students with events like this if it weren't for those professionals spreading that word. So we really, really appreciate that. And folks, if you are on any of these social media platforms, we hope that you'll give us a follow to get some updates on upcoming events or resources that may be available for you. And you can stay in touch that way as well. And you can always contact through our website, and we can get you in touch with people like Darren if you are looking for some more advice down the line. So thank you very much for joining us today, folks, and we hope to see you at a future event.